Good evening, my name is student Dr. Philip Panos, and today I'm presenting Appendicial neuroendocrine tumor, a case report. We have a 45-year-old, otherwise healthy Caucasian female referred to a general surgery clinic by her primary care provider for about 1.5 months of 5 out of 10 constant, dull, achy, and vague pelvic pain. To rewind a bit from initial presentation at the surgery clinic, about 1 month after onset of symptoms, she presented initially to the primary care provider who treated her for constipation. But the pain persisted, so they performed a colonoscopy, which was also unremarkable. Pain still persisted, and so they performed a workup for kidney stones and did a non-contrast CT, which was read as normal. A contrast CT scan was then performed, in which they found a soft tissue thickening around the appendix. And because of this finding, they referred to surgery clinic for follow-up. As you can see here, her past medical history and past surgical history, family history, and social history were relatively benign and did not contribute much to the presentation. She was not on any medications and she did not have any allergies. Her review of systems was positive for fatigue and some abdominal pelvic pain, but other than that was normal. As you can see here, her vitals are stable. She appeared mildly uncomfortable, not in any acute distress. Her abdominal physical exam was benign, other than some mild lower abdominal tenderness upon light and deep palpation, but there was no rebound tenderness, guarding, or rigidity. And cardiac and respiratory physical exams were benign. Her labs, her pregnancy test was negative. CBC and CMP were all within normal limits. As you can see here on the non-contrast CT, the green circles indicating focal dilations of the appendix. Initially, again, as I mentioned before, this was read as normal, and it was only after the findings in the contrast CT scan that they went back and found this retrospectively. This is the contrast CT scan, the green circles indicating, again, appendiceal dilation. During the laparoscopy, these are intraoperative images. On the left, we have at the center of the image, extending to about the 1 or 2 o'clock position, we have the appendix stretched out, and you can see the dilation of the appendix in the mid-body. On the right, between the laparoscopic instruments, you can see the appendix stretched out, and in the mid-body there you see some dilation. The laparoscopy revealed abnormal appearing firm mass in the mid-body, initially measuring about 1.5 centimeters. Other than that, the laparoscopy found normal tissue. There was no fluid, ovaries appeared normal, uterus appeared normal, surrounding bowel appeared normal. Appendectomy was performed. A pathological analysis, it was discovered that this was a well-differentiated grade 1, 4.5 centimeter neuroendocrine tumor. It did involve serosa, and it had a positive proximal resection margin. It stained positive for neuroendocrine tumor markers. The workup for metastasis was negative, though. Prognosis for this patient is fair. This is an indolent tumor. It's grade 1, well-differentiated neuroendocrine with no evidence of metastasis. However, it is at large at 4.5 centimeters, putting this in stage 3B, T4N1 M0 staging, because of the involvement of the serosa and positive lymph nodes, but there's no evidence of disease. The National Comprehensive Cancer Network states that any appendiceal neuroendocrine tumor that is greater than 2 centimeters warrants a CT abdomen and pelvis, and also a laparoscopic right hemicolectomy if deemed necessary. And in this patient, it was considered necessary. So I would like to draw your attention to the non-operative management of appendicitis with antibiotic therapy. Today, it is performed at select U.S. medical centers under very strict protocol for non-complicated or unperforated appendicitis. However, there is a 15 to 49% chance of recurrence, which will lead to additional emergency room visits and eventual laparoscopic appendectomy. So because of the low associated risk, laparoscopic appendectomy up front could be potentially safer and less expensive for patients. In regards specifically to this study, the risk of potentially missing a diagnosis of appendiceal neoplasm is something to consider, as it is increasing, as you can see below. And that is my presentation. Thank you for listening, and thank you for this opportunity. And here are my references.